Gonna put the sound. Can you guys hear me? Okay. All right. We're gonna move quickly through the questions. Um, I was trying to just do the background. I didn't really need you guys to see me, but we're gonna go through the questions quickly, and hopefully we won't get the echo. All right. I'm gonna share the screen to Mometrics. I'm gonna share the Mometrics. Okay. So the test is somewhat mimicking the actual live test. Um, yeah, it's actually trying to mimic the actual live test, which is multiple choice also. Okay. All right. So Mometrics is just a practice test. It's a free practice test that you can do also at home. All right. So sorry if you guys hear an echo. All right. So we're gonna try to at least do 50 questions. At least 50 questions. All right. So question one on the test. Um, the question. Let me just write something in the chat. Okay. So question number one, which has to do with the Maslow hierarchy. I suggest that you don't spend too much time on these types of questions, but just kind of be aware, just on a need to know basis. At the same time, I will say to not leave any questions blank on the actual test. Okay. And I'm sorry that the font is a little bit small. All right. Second question. A patient has a complete colectomy with an ileostomy. The nurse action that is the most important for the patient is which one? I'll give you a minute to see which one is the appropriate answer. If a patient has a complete colectomy with an ileostomy, the nurse action is the most important for the patient is what? I'm gonna go ahead and pick one of them, and then we'll go over it at the end. Question three, a patient is scheduled to receive hemodialysis at 10 a.m. and has several medication ordered at 9. What's the most appropriate action? Is it to give them medications at 9? Call the physician? C, hold all medications? Or D, give them medications that will be retained? I'm going to answer A and then we'll go through it again. Um, I'm going to, okay. A patient being examined by the nurse has McBurney's point tenderness and a positive draw sign. Which one is it? Is it pyelonephritis? Pyelonephritis has to do with the kidneys, cholecystitis, the gallbladder. And so they having McBurney's point tenderness, appendicitis, or meningitis. Which one is it? I want to say by elimination, it is appendicitis. I'm gonna skip 7. A nurse is caring for a patient who received radiographic contrast medium for procedure, and the patient shows signs of dyspnea, flushing, and pruritus. The top priority intervention is which one? Check vital signs, ensure the airway is patent, apply a cold pack to the IV site, or call the physician. Okay, so I'm gonna write the questions that I'm answering. I'm just gonna go through certain questions that I think you should know, and then so we can go over the answers and rationale. So we're gonna be moving a little quickly, and then I will be offering a more comprehensive. Um, right, so there will be a comprehensive depending on how many people's interested, but that one will be a lot longer. So this question, um, if a patient is being hospitalized and they're diagnosed with deep vein thrombosis in the right leg, what is the appropriate test? Okay, I'm gonna say Doppler and we'll go over that. A patient has been examined by the nurse experiencing pain and has right. Okay, I'm gonna. A patient is being evaluated for potential meningitis. Which of the following is not a typical sign or symptom associated with meningitis? So this means you need to have an idea what meningitis has to do with the brain. Itis, if you break it down, is inflammation in the brain. Which one is not associated? I know for sure meningitis, you find confusion and fever, so you can eliminate those two. Okay, so giving you guys a second. For that one, I'm gonna answer by elimination nystagmus, but I also do not know what Brudzinski is. So when we look at the rationale, just take some time to also review whatever you do not know. Okay, if a patient is newly diagnosed with, I'm gonna skip 18. I'm also gonna skip. This number 20 has to do with patients that are seizing. What's the preferred position so that they do not aspirate? I'm gonna choose the side position, and then we'll go over that. Question number 25. What complication will be expected in a renal patient who has large volume of fluid removed during hemodialysis? The key, so looking at the question, what's the key um words you're looking at? You're looking for the complications that is expected. If they took off a large amount of volume during dialysis, think about what could be something that you might expect. Shortness of breath you will expect. Chest pain you will not expect. These are complications that you won't expect. Redness at the needle insertion site, that's probably expected, but it's not a complication. So by elimination, it could be linked in abdominal cramps. So we're going to confirm that. That's question 25. So we're going to see if we can get through at least 50 questions. Um, question 27. The nurse noticed a patient's hands and feet become erythematous, which is redness, and a little bit swollen when the patient's warm, and pale, almost cyanotic when the patient's hands and feet are uncovered. Do you guys know what disease this is? That's red when it's warm and covered, and then when you uncover the patient's hands and feet, they become cyanotic. Which disease do you guys think this is? So when you're making flashcards, also make a flashcard for the ones for things that you might not know, like the Turner syndrome. Be familiar with what Turner syndrome is. Be aware of what an Osgood-Schlatter disease is. So be aware of what those also are. Okay. And then again, we're gonna go through the rationales. We're gonna go through the answers in a few minutes. Question 30. A patient suffers from a significant left middle cerebral artery stroke. The patient is right-handed. Which following deficit should we expect? So we're gonna know general rule if the left side got was affected with the stroke, which in this they abbreviated left MCA, which is the middle artery stroke. That means you always you should expect deficit on the opposite side and vice versa. So left middle, the right side is gonna be weak, but is it the speech or is it the visual? So I'm gonna answer it like this, and but we'll get more understanding when we look at the answers. Okay. Type 1 diabetes in question 33 mentions type 1 diabetes patients admitted with ketoacidosis. The nursing diagnosis that take priority for this diabetic patient is which one? Is it imbalanced nutrition, deficient fluid volume, impaired tissue integrity, or risk for infection? I'm gonna say deficient fluid. I don't think you remember it saying takes top priority. I mean, imbalanced nutrition is a priority, but I don't think it supersedes fluid volume. I think all of these have something to do with ketoacidosis, but remember they say top. Which one will you prioritize? And I'm gonna go with fluid volume. Yeah. Number 34. We're thinking adrenal crisis. Which electrolyte imbalance is common with adrenal crisis? So let's just take a minute. If you need to look up in a Google and see what an adrenal crisis is, I'll just give you a minute. And if you already know which one, you can put in the chat which one do you think it is. Is it hyperglycemia, hypernatremia? Is it hypokalemia or is it hyponatremia? Hyponatremia means no sodium. Hyperglycemia is high glucose, right? Hypernatremia, B, is high sodium. Hypokalemia is low potassium. Hyponatremia is low sodium. So I just want to let you guys know when you take this exam, they will not give you any. They will not give you any electrolytes like ranges. Like you need to know what they are. So I'm gonna go answer low sodium, and we'll go through that in a few minutes. Okay, a patient developed diabetes insipidus after surgery to remove a pituitary tumor, which again is in the brain. What is the critical complication of diabetes insipidus? What is the critical complication of diabetes insipidus? Is it bradycardia, which is low heart rate, hyponatremia, low sodium, dehydration, or hypokalemia? So C, we can eliminate because this is not a complication. They talk about critical complication. Low heart rate, is that could be a complication, but is it critical? I think the low potassium might stand out because remember with low potassium, that will give you irregular heart rate that affects your cardiac. A patient undergoes gastrectomy. Okay, okay, we're at question number 37. A patient undergoes gastrectomy for treatment of stomach cancer. The complication most likely to develop following gastrectomy is which one? Folic acid deficiency anemia, pernicious anemia, pancytopenia, or thrombocytopenia. Which one of anemias is a complication? So if you had to think about when they're having the surgery, what are they removing? Okay. So in the chat, I'm going to put, sorry about the phone background. In the chat, I'm gonna put the questions we've gone through so far. We went through question 4, 5, 6, 8, 13, 17, 20, 25, 27, 30, 33, 34, and 35. I'm gonna silence for a minute. I'm sorry about I was muted. I'm sorry. I'm talking and we're muted. So far we went through question 40 and now we on 43. We're on 43. Um did I move this thing? We did 40. So we did 40 while we were muted, where I answered a patient with sickle cell disease. I'm going to avoid areas of low oxygenation, is what I picked. 43 is when you educating a patient about hyperthyroid, what is the most common cause? And I'm picking Graves' disease. So if you guys think there's another answer, let me know. Because I want us to spend more time with the answers and rationales. Question 44. Which of this is not a complication of diabetes? So when you're doing this personal study, do spend a lot of time, good review on your diabetes. Because you know you're going to expect some questions on this, on different things that has to do with diabetes. So which one is not? We know that obesity is a complication. We know that obesity is definitely a complication. Blindness. So we can eliminate A and C. Okay. We can eliminate A and C, but what we so now we have B. We have B and D. Is renal insufficiency a complication of diabetes? Anemia. They said which one is not. Renal insufficiency could, I think, affects your diabetes, the diabetes, your endocrine system. I'm gonna pick anemia by elimination. This one I'm gonna put in here, but I don't know if you haven't worked a lot with psych patients, you might not be aware. Which in giving Haldol, what is the common side effect of Haldol? Is it polyphagia, facial swelling, tardive dyskinesia, or bradycardia? He said, what is the most common side effect? And I'm gonna say tardive dyskinesia. So that was 46. So our goal today is to go through at least 50 questions. Um, yeah. Which of the following patients are the least likely to be ordered Plavix? So now we're on question 49. Which of the following patient is least likely to be ordered Plavix? So think about what Plavix does. The patient with ischemic stroke, the one. So we're gonna say I'm gonna pick the patient who has a cerebral varices because that patient might be showing signs of bleeding, and the Plavix might aggravate it. So I'm gonna pick B. All right. So that was 49. Um, moving on to question number 52. Which of the following is not a complication in patients who have sickle cell anemia? Which of the following is not a complication in patient besides not? Okay. PE is definitely a complication. MI is a complication. So which one is not a complication? I'm gonna say C by process of elimination, and we'll see what the answer is. A patient has been diagnosed with diabetes insipidus. Which of the drug of choice? What is the drug of choice for treating diabetes insipidus? Question 55. Which Okay, which one? Does anybody know which one it is? A patient. So it's not KXLA. KXLA has to do with the potassium. Um, so I'm gonna pick C. Okay, I'm gonna pick C just by process of elimination. Okay, can you guys see it? I know the. All right, all right. I'm gonna go to question 56 at another time because it might be a lot involved with that question. So another, when we do the comprehensive study, we can do a question 56. Um, I'm also going to skip question 57. Which of the following is a first line treatment for Hashimoto's thyroiditis? Which of the following is a first line treatment for Hashimoto thyroiditis? First, you might want to look up what a Hashimoto thyroiditis is. It's not Lantus. Lantus has to do with diabetic patients. So it could be B, C, or D. It has to do with thyroids. I'm gonna and remember the key word here is first line treatment. I'm gonna go ahead and pick B, and we'll go through it. Which of the following is a treatment for active TB? Is it clindamycin, gentamicin, streptomycin, or penicillin? Which of the following is a treatment for active TB? Okay, I'm gonna go ahead and pick C. A nurse is examining a patient who is in hospital for acute asthma. He has known to have a history of using nebulizers. During the physical exam, the nurse noticed that he has cheesy white patches. Okay, so you guys know what is, when a patient has cheesy white patches, what is that called? What is this condition called? And can you guys remember how they treat this? All right, B. Which of the following will be a treatment of choice in acute asthma exacerbation? Okay, I'm gonna skip this one. Which of the following is true regarding sickle cell disease? I'm going to give you guys to read the questions and answers. Which of the following is true regarding sickle cell disease? going to give you guys some time to look at this one, maybe about 5 minutes, and then I will come back with the answer. I'm going to leave it here. Give you guys. All right, so we're taking a break. Hello, everyone. Okay, so the question number 64, I'm going to go ahead and answer it as patients who are heterozygous for the sickle cell traits are usually asymptomatic. This means that A, B, and C are false. Okay, I just guys want when you're studying for these types of questions, just make a mental note that if D is true, that means that A, B, and C are false. And we're gonna go more when we go through the answer section. It's gonna start making sense. All right, so I'm skipping 65 and 66. Um, si- 67. Which of the following is not a sign of hypoglycemia? So, in other words, so while you study, the way you study for these type of questions is okay. If the question says which of the following is so now you need to know which one is a sign of hypoglycemia. Diaphoresis is a sign of hypoglycemia. Altered mental status is a sign of hypoglycemia. Heart palpitation is a sign of. So the one that is not is a fruity smell bad. That means everything else is um so signs of hypoglycemia, diaphoresis, altered mental status, and palpitations. Hyperglycemia is fruity smelling breath. Okay, so that's hyperglycemia. Which of the following is not Which of the following is a sign and symptom of hypocalcemia? Hypocalcemia is low calcium. Okay. Think of if you're missing calcium in your bones or anything in your which symptoms will you have? Abdominal pain we can rule out. Bony pain is we can rule out. So B and D. I'm gonna pick Stokes sign. Stokes sign is like that twitching. We'll go through more when we go to the answer section. I'm gonna skip 70. A patient has a permanent pacemaker. Which of the following scans are usually contraindicated and distinguished? Is it ultrasound, an X-ray, CT, angiogram, or MRI? So if you've been working as a nurse for like say you're a new grad, they require that you do at least 2,000 clinical hours before you take the test. So if you've been working for about 2, 3 years in nursing and you have a patient that has a pacemaker, and there is an MRI screen that you had to complete for the patient. Um, so I just give you guys an answer because there is this. If you work with them long enough, you're gonna with a patient that needs an MRI, a patient with a pacemaker could be are usually contraindicated. Okay. And sometimes they will ask what sometimes I think right now with technology they ask you what type of pacemaker. So they have to know details if they allow it. So sometimes they'll make an exception, but they have to know what type of pacemaker. Um, okay. So that question from clinical experience will be D. Okay, 73. Which of the following is not a common treatment of diabetic ketoacidosis? Not is the key word here, not common. Okay, so I'll give you guys a few questions, a few minutes, and I think I'm gonna take a break now while you guys looking at this. All right, just give me about 5 minutes. Nurse Gina here. I'm back. All right, we're gonna because of time. We're just gonna have to do this again another time, and I guess I'm gonna wait to see um where the interest is at, and then I can offer this again. Question 73. I'm gonna answer D50 because right, what happened with these type of studying, you have to go through the answers, and I feel like we went through a lot of questions, and I don't know if we have to go through the answers. And the point of studying is that you have to take time to go through your answers and see why, understanding the rationales and all that. That has to take time. While I'm here, I'm just gonna, before I conclude, I'm gonna talk about some studying tips in terms of finding that quiet place. Okay, finding quiet places. Having a dedicated time to study. Okay. Um, I'm gonna end this session with question 77, of which one is not a sign of anaphylaxis, which is um like a anaphylaxis meaning a side effect or like a reaction, possibly to a drug. Okay. I went ahead and answered B. 168. So we did 68, 73. So 73, 77. So um that means we answered about, I'm gonna count how many questions we did, and we're gonna go through the answers. Okay. Okay, so 73. I'm counting right now how many questions we did. So one, two. So we only did 28. The goal for me was to do 50, but due to time, we're gonna cut it and we'll try to finish like around two. And and then we'll announce when we'll do this again, okay? All right. So we started around 12:30. We can do 50. All right. So we're gonna go back to we're gonna go back to the questions. So question four. Question four. A patient diagnosis is pre-renal. Oh, before I we go through the answers, I have to end the test first. I have to end the test first. I'm gonna finish and then it's gonna say, are you sure? Yes. So it's gonna give me a score. As you guys know, I got a low score because I didn't answer all the questions. So we're gonna do question four. A patient diagnosis is pre-renal failure. The nursing intervention that is top priority for this patient is to do what? So I don't know if at this time if you want to do some note cards, but you could put in your notes question four if you know like, you could put the number. And here's the answer. Is B, administer IV fluids, and here's the answer. Pre-renal failure is caused by decreased blood flow to the kidneys, which can lead to ischemia in the nephrons. IV fluid boluses may improve flow and improve perfusion to the nephrons. Antibiotics, oral hygiene, and repositioning are not top priorities in this situation. Okay. Pre-renal failure does what is caused by decreased blood flow to the kidneys. All right. Five. Um, I didn't think we went through this. I'm not sure. Patient is admitted for a stroke. The nurse noticed that the patient had developed contractures for the arm. Which of the following is not an appropriate intervention? The goal of preventive treatment of contractures is to increase range of motion through exercises and position. You do not want to put a sling because you want to do range of motion. A patient is examined by the nurse that has McBurney's and positive jaw sign. Which is this diagnosis? The diagnosis of acute appendicitis can be sometimes be aided by physical exam. McBurney's point is found in the right lower quadrant, two-thirds of the way between the ankle and the anterior superior. The jaw sign is elicited in the patient experience pain after they stand and fold. Okay. Number 8, a nurse caring for a patient. Okay. This patient is basically developing a side effect, a reaction. So the top priority is to ensure patient airway. If the airway is compromised, we need to call a code blue. Checking vital signs. Anything else, any other answers here is not a priority. And if a clinical path is not indicated. I'm going to move on to question number 13. Remember, we talked about the patient that diagnosed with deep vein thrombosis in his leg. Which of the following tests you're going to use will be ordered, you think so? So ultrasound Dopplers are the gold standard for diagnosing superficial vein thrombosis and deep vein thrombosis. So both deep and superficial vein thrombosis, they're gonna order the ultrasound Doppler. Okay. CT scans and MRIs are quite expensive, so they will not order it. These tests will not give any more information than an ultrasound could obtain. Therefore, a Doppler ultrasound is preferable. X-rays only evaluate bones. Okay. I don't think I'm skipping now to question 17. 17. A patient is being evaluated for potential meningitis. Which of the following is not a sign associated with meningitis? So they say nystagmus. So what is nystagmus? Um, I think it's something to do with the eye. We had look up what nystagmus is. It's not common. The classic triad of symptoms for meningitis is fever, altered mental status, and comorbidity. The Brudzinski sign is positive when infection of the neck usually causes infection of the This maneuver is usually to help the diagnose meningitis. Okay, it's not common. All right, we're moving to question 20. This has to do with the position for seizures. Which of the following is the position so the patient don't aspirate? The lateral recumbent position, which is the side lying position with the legs extended, this position helps prevent aspiration. A patient who is placed in other positions has an increased risk of aspiration. When a patient is vomiting, seizing, he should be sat up, placed on his side, and try to turn over. Um, What complication would be expected in a renal patient who had a large volume of fluid removed dialysis? Okay, what should be expecting is leg and abdominal cramp. Again, if you work in the clinical setting for a while, you will find a patient that's a typical MedSurg for dialysis patient. But I have to be honest, I've been working in MedSurg for a while. I just maybe recently um but you might all not always, so that's how I remember this it's due to electrolyte fluid removals to make breathing easier and not cause shortness of breath. Chest pain is associated with excessive fluid and maybe a sign of infection. And we're gonna move to question 27. So the nurse noticed that a patient hands and feet become erythematous when the patient is warm. The sign up. This is a classic sign of renal disease. It's caused by the body's abnormal response to cold weather and to stress. The body significantly decreases the blood flow to the extremities, causing pallor or sinus anesthesia, which is numbness, and response to cold weather. So we move, yeah. So just and I'll talk about having that dedicated study. Um, we did question 30 has to do with stroke. This patient had a stroke on the left middle cerebral artery stroke and is affecting his right-sided with speech deficit. Since the brain controls the contralateral aspect of the body, a left-sided stroke will result in right-sided weakness. The middle cerebral territory is where the language center brain is located. A significant MCA stroke would likely result in some speech deficit. Visual deficits are usually caused by occipital lobes. If you're making a flashcard, just kind of make the difference. If it's an MCA stroke, speech is going to be affected. Visual deficit is which part of the brain, the occipital lobe, affects the visual. So that's something that you might want to go over. We move to question 30. Type 1 diabetes is admitted with ketoacidosis. Ketoacidosis is a severe disturbance of protein, fat, and carbohydrate metabolism results from profound insulin deficiency. Levels of counter-regulatory are marked increase in antagonizing effects of insulin. Therefore, there's a lot of alcoholic diuresis leading to severe dehydration. With this, electrolytes are being depleted. So this one is a good thing to just kind of spend time reading these rationales. This is how you're gonna go into the intense study. Okay, you're gonna really dedicate that time to study each question. So it, you know. Whether you want to do 2 hours a day leading up to the exam. The only thing you do not want to do is cram for the exam. Okay, go ahead and put that in. Do not cram for the exam and answer. Okay, so I'm gonna go ahead and put this in the notes while you guys go over question 35 of what is an adrenal crisis and which electrolyte imbalance. Take time to read the rationale. So I'm gonna go ahead and put that in the so tips is tip one, make so I'm offering you some tips. Tip three, test day. You want to answer all questions. Do not leave any blanks. Okay. So, okay, we're moving quickly. 34. We got 35 is the next question. Okay, did you guys read why is adrenal crisis of the electrolyte imbalance is low sodium? Okay. Aldosterone regulates the absorption of sodium and excretion of potassium. Consequently, large amounts of sodium chloride and water are excreted in the urine, resulting in hyponatremia. The patient in adrenal crisis will also have hypoglycemia, okay, not hypoglycemia. So this is something to make a note of also, that this patient will also have low sugar, low glucose. 35. A patient developed diabetes insipidus after surgery to remove a pituitary tumor. Complication, critical complication is low potassium. The most dangerous complication caused by excessive diuresis. Okay, low potassium levels lead to cardiac arrhythmia, such as heart block, ventricular tachycardia, and cardiac arrest. Diabetes insipidus is associated with tachycardia, hypotension. So just make note of that. This will also increase heart rate and low blood pressure. Patient's serum sodium levels increase because the body takes sodium as potassium is excreted. Okay, so that's something. Dehydration is a complication, but it's less serious than hypokalemia. Low is pretty serious and dangerous. Then we move into, I think there was 37 was on there. A patient undergoes gastrectomy for treatment of stomach cancer. The complication most likely will develop pernicious anemia. A gastrectomy removes the source of intrinsic factor. The stomach lining which is needed to absorb vitamin B12. Therefore, pernicious anemia is a risk. Okay, so That's 37. Really, let's look at question 40. This has to do with the sickle cell disease patient. Our nurse is doing some nurse education, patient education with sickle cell. Okay. Avoid areas of low oxygen concentration. 43. A nurse is educating a patient with hyperthyroidism when the patient asks what is the most common cause. Which one is it? It is Graves' disease. We got that correct. Graves' disease is caused by an autoimmune response that's caused the body to produce excessive thyroid hormone. Symptoms can cause tachycardia, unintentional weight loss, tremors, irregular menstrual cycles, and bulging eyes. Many things can cause hyperthyroid, but Graves' disease is the most common. Treatments also include um, propylglycol and tapazole. Okay, so this is a good flashcard. That way, you can have all the symptoms of what hyperthyroidism. So that's why I want you guys to review the answers because they give you all the other symptoms also. So this is a good way to do a good study review. 44. Which of the following is not a complication of diabetes? Diabetes will not cause anemia. Okay. Diabetes have high levels of blood glucose. Since their pancreas produce insufficient amount of insulin, which can lead to obesity. High levels of blood glucose stimulate systematic inflammation and atherosclerosis formation, causing a multitude of other pathologies. Atherosclerotic plaques decrease the lumen of blood vessels, causing hypertension, blindness, and renal insufficiency. Okay. Okay, we're gonna move to question 46. Question 46. When giving Haldol, a nurse should know that the common side effect of Haldol is tardive dyskinesia, which is the abnormal involuntary movement of the tongue and lower face. Okay, so this is something good to know. And when we do the more comprehensive studying, we're gonna go through some of the common drugs. Okay, so you want to be, can some people name some of the common drugs we see in the med-surgical units? Protonics, Lasix, your diuretics, your Synthroid, your Capra, anything you do, any medication for seizures. What are some of your common cardiac medications? Depressor, the common cardiac, your Digox, kind of have an idea. Your Coumadin, what the labs that you look for with your your heparin, plus the labs, right? So just kind of do a good review with those. All right. So 47, 49. Which of the following patients are the least likely to be ordered plastics? From the choices given, patients with esophageal varices have the highest risk of bleeding. So they are the least desirable patient to be given Plavix. Patients with ischemic stroke, heart attacks, and cardiac or surgical procedures are Plavix postoperatively. Plavix prevents platelets from sticking together too readily, which helps to prevent against clot formation. Okay, so that's question. Okay, then we move into question 52. 52 is another question that has to do with esophageal varices. So you might want to put 49 and 52 together. Which of the following is not a complication in patients who have sickle cell anemia? Sickle cell disease is an autosomal recessive disease that causes a red blood cell to be abnormally shaped. This can cause chronic anemia, renal failure, cardiac arrest, splenomegaly, stroke, heart attack, and pulmonary embolism, right? So that covers A and B. There is no cure. It does not cause esophageal varices. Okay, so which of the following is not a complications diversity? Esophageal varices are dilated veins and esophagus commonly caused by cirrhosis due to alcoholism. All right, so it's not a complication, but the other three. So we're gonna move to question 55. A patient has been diagnosed with diabetes insipidus. What is the drug of choice for treating this condition? Desmopressin is another name for antidiuretic hormone used in treating those who have diabetes insipidus. Diabetes insipidus is caused by insufficient ADH, which causes the body to convert little. Insulin is used for patients with hyperglycemia. Insulin is used for patients with hyperglycemia, usually caused by diabetes mellitus. Decadron is a steroid used to treat. So by elimination, we should have been able to answer correctly because desmopressin is another name for, yeah, this is the drug of choice, okay? So just kind of commit that to memory for 55. 58. Which of the following is the first line treatment for Hashimoto's thyroiditis? Synthroid or levothyroxine is a synthetic thyroid hormone used to treat Hashimoto's thyroiditis, which causes hypothyroidism. Okay, and the hyperthyroid caused by Graves' disease. This is a type of, okay, exogenous insulin. So, okay, so let's go with this again. So Hashimoto's thyroiditis is used to treat is it which cause hypothyroid. So Hashimoto's thyroiditis is hypo, low thyroid. So that's why they're using Synthroid to treat it. But the other two drugs, Tapazole and Propafol, treat hyperthyroid, the high thyroid, which causes Graves' disease. So this one is a really, when we do study again, I want to go through this one again. This is a good note card question. Okay. All right. Which one is active in TB? Like what would treat TB? Active TB is streptomycin. So just commit that one to memory. Because the question answer will also go with what the other drugs treat. But streptomycin is a drug of choice to treat active TB. Number 60. What is it called when you examine a patient and they have that cheesy white patch on their head? It's called oral thrush. Thrush is a yeast infection seen in patients who are poorly controlled diabetic, those who have been on long-term steroids and antibiotics in immunocompromised patients. It is similar in appearance to euplasia, except the causes of thrush in which white lesions must be scraped off. The causes of leukoplakia are unknown. Okay, they're talking about A, but it's commonly seen in alcoholics. So they went through the other three, but so just know oral thrush is they call that when you have that cheesy white patch. And the drug they use in the hospital that the you'll see doctor order to treat that is nice and switch. 64. I guess I didn't answer it. This one was true regarding sickle cell disease. Each patient who has heterozygous for the sickle cell states are usually asymptomatic. Sickle cell disease is an autosomal recessive genetic blood disorder caused by defect in chromosome 11. Okay. Patients who have only one recessive allele have sickle cell trait. They are usually asymptomatic and do not suffer the same medical complication as those with the disease. Sickle cell disease increases the risk of stroke, heart attack, pulmonary hypertension, skin ulcers, priapism, as well as other health problems. Okay. Sickle cell disease does not increase the risk for diabetes. All right. So this one might have to spend more time. Like when you buy the book, there's when you go purchase the book to like the MedSurg book, you want to spend some time with doing a good review for the diabetic patient, your sickle cell patient, and of course there's a lot of other diagnoses that you want to know your CHF patient. So we'll go through it like when we do the more comprehensive study. Okay, then we go into question 67. We're almost there. 67, 68. Which of the following is not a sign of hypoglycemia? Okay, so this was a very easy one question. On the test, it's not that. I think one third of the test is like direct questions like that, and then you have a portion of the test has a lot of case study type of questions, and they are a little complicated. But you do have like maybe a third of the 30% of the test that's like direct questions like this, which I feel like is the level of difficulty is not that difficult. Okay. Um, which of the following is not a sign of hypoglycemia? Um, what are the signs of hypoglycemia? Diaphoresis is a type of hypoglycemia. Also, mental status and palpitations are all signs of hypoglycemia. Hyperglycemia is fruity smelling breath. Okay, that's high, and it's also a sign of ketoacidosis, which will occur in a hyperglycemic patient. Okay, other signs of low blood sugar are also nausea, vomiting. Okay, so this is how you will study and then you commit to, kind of get a memorize some of the hypoglycemia. There's also polyphagia, tremor, weakness, and in rare cases, you will have seizures. Because people have low blood sugar. And then I think I've also heard people go into a coma. I've seen some places they say they can go into a coma. Have you heard of people saying they can go in a diabetic coma? Receiving sugar either by mouth or IV, even by the patient is lethargic, will correct this hypoglycemia. So that's 68, which is a form sign of low calcium. Slow text sign is positive tapping on a patient's sarcoma, induces facial twitching. It's commonly seen in those with low calcium. Okay, so this is how you can remember. And they also talk about of high calcium. All right, 16. So we just have two more to go. 73 and 77. 73. Which of the following is not a common treatment for diabetic ketoacidosis? D50 is not used to treat diabetic ketoacidosis. Okay, the administration of D50 is used for patients with hypoglycemia, low sugar, blood glucose. D50 will only worsen hyperglycemia. Diabetic ketoacidosis is high blood glucose, which is hyperglycemia. It will make it complicated. Lantus is long-acting anti-hyperglycemic medication, and acute hyperglycemia short-acting insulin should be used as well. So you would treat it mostly maybe with Lantus. Fluid hydration can help it. It's important because patient ketoacidosis are usually dehydrated. The IV helps correct the dehydration electrolyte abnormalities that may have occurred because of the dehydration. Hypokalemia is often presented with DKA. So this is something I want you to remember. When a patient that is diabetic ketoacidosis, they get dehydrated, so they're going to need fluid replacement. The Lantus is long acting. It is hyperglycemic and hyperglycemia. So they need the Lantus, they need the IV fluids, and the dehydration is going to cause electrolyte abnormalities, which will give makes a patient hypokalemic, low potassium, and this is what they said is often presented with DKA. So at this point, you should be expected to replace the low potassium with IV potassium. Okay, so you should expect to be treated with IV potassium chloride. Okay, so that's a good review of that. Okay, then our last question is this is our last question. Which of the following is not a sign of anaphylaxis? Which of the following is not a sign and symptom of anaphylaxis? Okay, so anaphylaxis, like some kind of like a some type of reaction. Angioedema, like some people if they're having some kind of systemic reaction, this is like swelling. Okay, cardiac arrest. You could go into cardiac arrest if you're having an allergic reaction. Okay, so let's see here. Urinary and bowel retention does not occur with anaphylaxis. Bowel or bladder incontinence, rather than retention, is usually associated with anaphylaxis. Respiratory distress leading to failure, cardiac arrest are two of the most serious complications that may occur. Angioedema, which is the swelling of the tongue, can occur with facial swelling. And they would sometimes treat it with some steroids. All right. So those are the questions we went through. Of course, there's 150 questions. So we can schedule again for another time. Okay, we can schedule another for another time. You guys can put when is a preferable daytime, nighttime. If you can put your hour preference, let me know. Is it weekend or weekday? I can also try to meet with people on a one-to-one. Okay, I could try to meet with people one-to-one. Um, and then again, I'm trying to plan a more comprehensive study. So, depending if you guys will sign up with me, follow me. I'm gonna put on Nurse Travels on Facebook or Instagram. I'm gonna just give you guys my email. Maybe that will be the contact. Let me know when's a good time. I'm willing to do one-to-one study. Okay. Okay, so we're gonna try to do one-to-one study sessions. So that's it for today. It's already 2:15. I'm just gonna give a few minutes for questions. I'm gonna stop sharing. I'm gonna give you guys a few minutes for questions and answers. Again, I just want to emphasize how important it is to have a dedicated time. You want to have a dedicated time to study. Okay. Um, I mean, even though you might feel like you know the material, um, you might think that you know the material, but just try to spend some time, find a quiet space at home if you have to go to the library, and just kind of come with a study pattern. Maybe you need to study one section at a time. Um, Again, this test is covering about six different sections. There's a cardiovascular, there's a gastrointestinal, there's the respiratory. Um, so you might have to, so the six sections you might have to do one section, yeah, at a time. Um, so again, I'm going to offer you guys the tip. Tip one is have a dedicated time to study. Okay, like have a dedicated time to study. The second tip I put in the chat was do not cram study the day before the test. Do not cram study. And day three, the day of the test, on the day of the test, you want to answer all the questions. Do not leave any questions blank at all. Do not leave any questions blank. Okay. All right. So that's it for today. Since there are no questions, get in contact with me at the email. Get in contact with me and just put on the subject line MedSurg study review, and then I'll be able to contact you right away. And then just kind of follow up for any future announcements or when I may have another study session. Okay? All right. All right. Thank you guys.